Hey everyone, this is David Hemm with Imago Dei Insurance Advisors. I am here today to actually share with you guys a very exciting new product that we're able to offer. So we are considering this our 1099 offering. This is perfect for individuals, for families. If you are an individual who is either on the marketplace, so a marketplace plan, you're not very excited about it. You might just be 1099, not sure what options you have. There's a lot of different options out there in regards to maybe some lower benefit options. There could be ones that maybe some of you are on Christian shares. There's a lot of things that exist out in the marketplace, but we wanted to bring something that was unique and different. We were trying to think about really what would be the most helpful for people. So this is our major medical solution. So this is a full insurance product. So this is not a health share. This one is fully backed by insurance. Again, this is aimed and geared towards individuals and families. This is something that's unique in that it is a PPO plan. So if you're on a marketplace, especially if you're somewhere like I am in Texas, the PPO offerings are not something you can find on the marketplace. You usually can only find an HMO offering. So this gives you a large national PPO network. But let's talk a little bit about what is the Imago Dei difference. So really, what are the three things that we thought were most important and that really stand out to why this plan in particular is very interesting and why it, I believe, is one of the strongest individual offerings on the market right now. So first off, everyone is concerned about this. So let's talk about that, which is cost effective. So if anyone can tell me about this. What's the thing that you hate the most about health insurance? If I had to guess, the thing that you hate the most about health insurance is that you're paying for something that's very expensive. For many of you, you're paying for something that you hardly ever use. And then when you do go to try to use that thing, you just continue to pay more money. So at the end of this, you sit around and you feel like, why did I even bother having insurance to begin with? All I did was pay a lot. Then when I needed to use it, I just had to pay more. And I feel like it was a waste of time and waste of money. This plan aims to actually give you a way out of that cycle. So number one, this plan is cost effective, meaning care coordination will give you an opportunity to eliminate your out-of-pocket costs. So what does that mean? That means that if you go through the healthcare navigation, if you go through our healthcare advocacy in order to access your care, you will actually have the ability to get $0 primary care, $0 mental health, $0 virtual care, $0 surgeries, $0 maternity. Most generics are $0. We can do $0 labs, $0 imaging, as much as even a lot of hospital outpatient procedures, sometimes inpatient procedures. So this plan actually eliminates this cycle that we've stepped in, which is this continual having to pay. This actually gives you an option in a way to be able to use your health insurance. And then when you go to, or buy your health insurance, and when you go to use your health insurance, there's actually a way that it would be no out-of-pocket cost to you. So the second major thing is care. So it's all fun and games if you're not paying much, or if it's budget friendly, or it's packed with value, which I believe is true of all of these things with this plan. However, if you don't have superior care when you need it most, the plan kind of falls apart. So one of the distinctives of this plan is that it comes with a dedicated white glove care coordination team. So we mentioned them before about being able to access the care, but this team is able to help you find care at the lowest cost and highest quality. So normal human beings, normal individuals, don't typically shop their healthcare, meaning you go to a doctor and they say, hey, you need to have a surgery. And they say, just go talk to that guy across the hall. And you go, okay. And you get up and you walk across the hall. That's about the extent of the homework that we do to make sure if a doctor is good or reputable. And the care coordination team can actually help you navigate that process. So they have data. There's a lot of data, in fact, that we can actually review and look to see um, how reputable is that doctor? How reputable is the hospital that it's at? How often has that doctor had to repeat this surgery? How is he rated well? Is he, he or she currently under investigation for something? Or is there an outstanding complaint against them? These are all things that you would want to know before you have that person perform the procedure. So, a concierge can actually help you navigate that process. They can also help you find the care that you need, whether that's medication, whether that's, like I said, surgeries, outpatient, just specialist doctors, anything like that. You can go ahead and call them and they will be able to help you walk you through it. You have an advocate on your team that's able to actually help you navigate the difficulties, the complexities. They can help you with billing. They can help you understand what it is that you're paying for. So the last distinctive is better access. So why does better access matter? Well, if you have a plan that is cost effective, meaning that there's a ton of value for the price, you can receive superior care. So you actually have a way in which you can receive the help that you need, but you don't have access. That becomes a problem. So what do I mean with access? That's the ability to go to doctors, right? That's the ability to go get your surgeries, to see those specialists, to see your doctors. If you don't have access, all of that becomes kind of a waste, right? All that becomes a problem. So what's with this plan? One is it has an extensive nationwide PPO network, right? So it's on a very large PPO network. It also has exclusive direct contracting, meaning that not only is there a PPO available, but also there have been work on the back end to provide direct contracts with high quality doctors, or what we would call as value based doctors and hospital systems, to be able to get the care that you need. And lastly, part of access is also how do you use this plan? So between the membership portal, between the app, they're basically top tier technology. So there's easy to use, intuitive technology that makes it very easy to navigate your healthcare. So it's something that you don't have to worry about, whether it's an easy customer service number that there's actually people there that pick up. It's not just auto generated, or a portal to be able to actually see everything, to be able to track everything, to be able to have access to everything at your fingertips. So these few things, these three things, we would consider and call the Imago Dei difference. It's cost effective, there's superior care, and there's better access. So if this is something that sounds great, if this is something that interests you, please reach out to us. We'd love to go ahead and talk to you about it if you have more questions. I'm also going to provide links to this flyer, be able to get links. There's a get a quote button. So if you want to go ahead and actually take a look and see, hey, David, this sounds a little too good to be true. This probably costs an insane amount of money. All I'll say is it's age banded. So it depends upon your age. If you're in a younger demographic, I believe that this is actually very budget friendly. I think that this competes at a price point that is very competitive. And because of the tremendous value that's packed in it, I don't believe that you can find other things in this price point that give you the same type of value. So again, this is a full major medical plan. There are no cap limits. It's inclusive of pre-existing conditions. That isn't a knockout. There's no knockout questions. There's no health questionnaire in which you fill out the questionnaire, and depending upon how that questionnaire goes, they'll rate you, or depending upon how that questionnaire goes, they can knock you out, meaning they could just decline you to give you coverage. So this doesn't work out that way. There is, in fact, a health questionnaire, but the health questionnaire exists to be able to provide you managed care before you even step into the plan. So if you have something that you're working through, that you're working with, a member of that healthcare advocacy team most likely is going to reach out to you before your plan is even effective, because they want to be able to work with you to come up with a plan to manage your healthcare before you start using it. So that, in a nutshell, is what we're calling our unmatched solution. But I'd love to talk to you more about it. If you would like to, please feel free to reach out, or if you're ready to go, just go ahead and get that quote and we can go ahead and get it going for you. Thank you so much.